Celiac disease versus lactase deficiency. These are very lengthy, extensive topics, but I will discuss only the highest yield points that are important on USMLE and various NBMEs and UWSAs. And one of the highest yield difference that we see in both of these conditions is iron deficiency anemia, which is present in only celiac disease, but not in lactase deficiency. I will ask you guys one question. What are the biopsy findings in either of these conditions? Yes, on celiac disease, you see blunting slash flattening of intestinal villi, whereas there is normal biopsy in lactose intolerance. So most of the iron is actually absorbed in the duodenum, and due to disturbance in intestinal architecture that we see in celiac disease, there will be reduced iron absorption in the duodenum and will lead to iron deficiency anemia in celiac disease. So if on USMLE you come across a scenario where which is where there is no definitive clue that can help you make a diagnosis, uh, and it's unclear and it's vague, and you're confused between either of these two conditions for diagnosis, but the blood picture shows low MCV, low hematocrit, then it's very clearly points towards iron deficiency anemia and helps you diagnosing celiac disease. In celiac disease, there's hypersensitivity to gluten, so you have to avoid wheat, rye, oats, and barley. Whereas in lactose intolerance, there's only disaccharidase enzyme deficiency in the intestinal brush border. You have to avoid the dairy products. And in celiac disease, you do antibody screening as your first step, and you are going to look for IgA, anti-tissue transglutaminase antibodies, anti-endomysial or anti-gluten, anti-gliadin antibodies. Whereas in lactose intolerance, you look for low stool pH, or you do hydrogen breath test as the best next steps. USMLE also wants you to know that lactose intolerance can also occur secondarily, which is called secondary lactase deficiency, following, for example, due to a viral gastrointestinal infection. There will be a scenario about an unvaccinated kid under 5 years of age who had an episode of viral gastroenteritis and now has blotting following dairy products consumption. So that's typically secondary lactase deficiency due to viral gastroenteritis damaging intestinal brush border, leading to secondary lactase deficiency and subsequent lactose intolerance.